Good morning, Dr. Jonathan Lazar. It's time for Daily Dose with Dr. Lazar. And have you ever thought about, am I getting the full story? You know, when there's a procedure recommended or a test recommended or something by a doctor. Um, have you ever asked yourself, hey, I don't know if this is the full story. Why am I being told to do this? So I want to talk to you today about what your doctor and your insurance company don't want you to know. Now, let me start out very clearly by saying I think this is the result of insurance companies. So what I'm going to say is definitely expose level stuff, but it's not to throw any professionals under the bus. I have a lot of close friends that are medical doctors and they're kind of stuck in this whirlwind. So if anything sounds negative about what the doctors are doing, I truly, truly don't believe that it's their choice. I think it's stuff coming from the insurance company. But I think you, as a health consumer, need to know some of the stuff. So one of the things I'll tell you too, I pride myself on honoring God with excellence in everything I do. So if I post something on this video, it's researched, I've done the work. None of what I'm saying here are opinions. You're not going to find that with me. Between here and our radio show, your weekly checkup on WMUZ, you can fact check everything. We are not people who just have an agenda who are trying to get our opinion across. It's very scientifically based, or based on what we were told in interviews and those sort of things. So anyway, bottom line, one of the main things, if you go to your doctor and and you feel pushed for anything, there is something else behind it. I just had a meeting with a medical doctor last week, talking about this and how we can offer better care. She has completely gotten out of organized medicine, where she's not doing any sort of insurance, because the insurance companies dictate so much of what can happen. And the main takeaway after all these facts that I want you to know is that your health is your responsibility. I can't tell you how many times people go to the dentist twice a year, but they need to go 4 times a year, but they only go twice a year because they think their insurance company's guidelines of twice a year are the best for them, and it's not true. So your health is your responsibility. Don't let the government or the insurance companies dictate what you need. Always, always, always get the care you need, and don't let anybody else dictate that. If you check in at a doctor's office and they're asking you, hey, do you want your flu shot? And then you get back to the room and the medical assistant asks, hey, do you want your flu shot? And then the doctor comes in and says, hey, do you want your flu shot? That should raise some questions for you, because if things are a good idea, people will typically choose to do those, right? And if you're asked over and over and over again, the feedback I got from an interview last week was that that physicians have to have a certain number of compliant patients. In other words, for women, if you don't have your mammogram at a certain amount of time, if you don't have your pap test at a certain amount of time, if kids don't have vaccines at a certain amount of time, all of these things, if there aren't enough flu shots given, their funding literally gets cut. Now, they may be encouraging you to do these things because they believe in the validity of them or how much they help your health. But regardless, they definitely get their funding gets challenged, their pay gets cut, all of these, when they're not able to have people on a certain number of procedures and that sort of thing. I think it's really important. The other thing I think is really important is insurance companies typically are just administering a policy. So a lot of people think that, like, if you go to the doctor and the insurance sends the doctor $1,000, that came out of the insurance company's pool of money. Most of the time, large corporations in the United States are what's called self-insured. They use their own money to insure their employees, but they'll use an insurance company like a third-party administrator, where Blue Cross, for example, uses Ford Motor Company's money to just kind of administer the policy. The payoff to the insurance company is they actually get to keep a percentage of the money that passes through them. So if you look at less expensive procedures, like a year of chiropractic care, corrective chiropractic care, for example, the rate for that of really high quality, stand the test of time, show objective measurement changes and show x-ray changes and nerve scan changes, good quality corrective care would be a fraction of the cost of several months of physical therapy paired with injections, paired with, you know, surgeries, those sort of things. And so people think, well, that's really weird. Why wouldn't the insurance company want to pay for me to do these less expensive procedures, especially if they're more effective? And the reason is they get to keep a portion of the money that they pass through. So if they're going to pass through $5,000 for chiropractic care or $160,000 for an expensive spine surgery, which one do you think they're going to want? And I think it's really important for you to know that. So bottom line is, please, please, please do not ever let an insurance company determine the care you need, where you need it, the kind of care, how much care. You determine with the experts, you determine with your doctor team that you trust, that's vetted, that has given you great advice. You determine with them what you and your family need. And if insurance helps, great. If they don't, it doesn't matter. Like, insurance doesn't pay for organic food. Insurance doesn't pay for oil changes. Insurance doesn't pay for gym memberships. So think about it. Your health is your responsibility. I got to put my glasses on because I'm old and I can't see. Okay, so Pamela says, yes, they have quotes to meet. At least 80% of their patients need to have mammograms and other tests or funding is withheld. Absolutely. That's exactly right, Pamela. I agree. Well, listen, any questions, please leave those below. Like and share these videos so that your friends and family can have access. Side note, we are doing a migraine solution workshop in Ann Arbor at our office. I have to look at the number for you to text, and I'll post it on here. It's Wednesday, so if you're watching this video live or soon, you know, after I did it, you'll be able to register. But we're doing a migraine solution workshop Wednesday, February, let me get the date for you, Wednesday, February 12th, 6 p.m. in our Ann Arbor office. And the number for you to text if you're interested in registering is 734-659-2023. I'll post that in here, 734-659-2023. Text the word migraine. Text the word migraine to 734-659-2023, and you can get a link to register for that. So if you know somebody suffering with migraines, please tell them about this workshop. It's only $15. It's just to make sure that our costs are covered for doing it. $15. And text the word migraine to the number I'll post below. Any other questions, please post them, like and share the video. This is Daily Dose with Dr. Lazar. I'll see you tomorrow. Have a wonderful day.